Good morning, everyone, and welcome to the PHLCVB's Ask Dr. Nash Zoom event. Thanks for joining us. As most of you know, the PHLCVB has long been a leader in utilizing the amazing health professionals and resources of our region to help attract meetings and conventions to our destination. Our PHL Life Sciences Division was started over 30 years ago for that sole purpose, and is today comprised of 50 advisory board members from the healthcare industry, and has been led by our amazing executive director, Bonnie Grant, for 12 years now. When COVID-19 was progressing, Bonnie established a 20-member subcommittee as a resource to help the PHLCVB relay information and share resources with our clients, members, and local partners. When we realized there was an enormous amount of information in the public, and much of it was hard to decipher, we felt the need to partner with someone in the local healthcare industry that could serve as an external voice. To support this effort, the PHLCVB has partnered with Dr. David Nash, Dean Emeritus of the Jefferson College of Population Health, as the PHLCVB's Chief Health Advisor. An acclaimed national leader in population health, Dr. Nash is an endowed chair professor of health policy at the Jefferson College of Population Health, the first of its kind in the country, where he served for more than a decade as the founding dean, culminating in a 30-year tenure. A board-certified internist who holds both an MD and an MBA, Dr. Nash is internationally recognized for his work in public accountability for outcomes, physician leadership development, and quality of care improvement. Most recently, he has been lauded for his thought leadership surrounding the COVID-19 pandemic. Before we get started, I need to state that this discussion with Dr. Nash is to serve as an informative matter based on his knowledge and experience. As always, please refer to the guidance offered to you by your organization, the CDC, and state and local authorities. Please use today's discussion as a thought starter while planning your next great event. Dr. Nash, welcome. I know you've been extremely busy over the past 6 months, but let me start by asking, how have you been since it all started?
You're so sweet, and hi to all of our colleagues from around the country. Thanks again for having me. I would say I'm doing okay for an old guy. I had an interesting experience in the last couple of weeks. I got my Medicare card. Wow. So that system's working pretty well. And I'm 2 months away from official Medicare hood. So that's a real milestone. But other than that, we're doing okay, and family is safe, and it's a day-by-day situation. I think, as my millennial children would say, Kevin, I'm COVID okay, which is code word for hanging in there.
Good. Have you done any traveling? Did you get a chance to get away this summer at all, or enjoy a vacation?
Yes. So we did two things. Thanks for asking. So my physician wife and I took a plane ride, more on that later, to Florida to see friends and others for 1 week. That was back in July. And then just a few weeks ago, we drove to Shepherdstown, West Virginia, and we did some hiking, and we visited places like Harper's Ferry and the Antietam battleground. Really fantastic, easy to do. And stayed in a very nice inn there. So I've had a hotel experience and airline experience all in the past summer. This has been very interesting, and happy to give you the details.
Oh, good. Well, thanks for sharing.
You're welcome.
We've got about 80 customers and partners that have joined us this morning. So we're so thrilled about the participation. And we received a number of great questions from so many of you. So to our partners on the phone or on the call, thanks for participating, for sending us some questions. What we've done is try to combine the questions as best possible into certain categories. And I think we've done a pretty good job. We've got about 10 questions outlined, and we'll see where the conversation goes with Dr. Nash. We'll break away from that. So
great.
To get started, the first question, we received quite a bit of questions regarding the vaccines, and obviously there's a $1 million question, but when do you expect the vaccine to be available? And given that the FDA has approved, accelerated timelines for this development, what will be your confidence level in its safety and effectiveness?
Wow. So first of all, as you noted, Kevin, I'm not a virologist. I'm a primary care internist. I've been in practice for 35 years. So but disclaimer, not a virologist. But with that, like most of the smart folks on this call, so I'm tracking most of the major global vaccine developers, like I'm sure you are, and reading everything I can from the New England Journal to the Wall Street Journal. I was very heartened to see in yesterday's newspaper, so this is timely, all of the major corporate giants, Alex Gorski from Johnson & Johnson and his peer group signed that pledge about the safety of the vaccine. And of course, we learned yesterday and the day before about the AstraZeneca Oxford situation, this one patient with transverse myelitis, and we don't even know which arm of the vaccine trial she was in, so more news to follow. But let me get to your question. I'm incredibly confident that we will have a safe and effective vaccine sometime in early 2021. As you know, the National Academy of Medicine, the National Institutes of Health, and an outside advisory board, they've already created guidelines. They've created the 4 phases, as they call it, of potential vaccine implementation. So I'm confident that we're going to have a safe and effective vaccine, not in 2020. However, I think it's unrealistic to think about it, especially before the election, which is, 50 plus days away. So this is not going to happen immediately. I think we could all look forward to having different types of vaccines, right? There are multiple technologies involved, some based on basically the protein, pieces of the virus, and others based on some amazing genetic manipulation, the so-called RNA type virus. We could get into that later. So look, we're going to have a safe and effective vaccine probably right after Christmas. And then we are going to have to follow these 4 phases of who's the appropriate person and in what order to get the vaccine. I'm very confident about that. And I would add, I'm looking forward to getting a vaccine. And I think most clinicians, not just doctors, nurses, pharmacists, I don't know everyone, of course, but I think most of us will be reassured by the public stance that these companies have taken. So this is an amazing scientific accomplishment. It'll be the most important product of the century, for sure. But I'm looking forward to a safe and effective vaccine post-Christmas in early 2021.
You mentioned, and I think we read that there's a number of companies working on a number of different options.
Right.
Is it fair to say that there could be a possibility to where we here in Philadelphia receive one vaccine, but say, for example, one of our partners, Brian Rubin, lives in Colorado, in Boulder, Colorado. He might get a different vaccine?
Yeah. I think it's highly likely that there'll be different vaccines that will all be safe and effective because different technologies are being used. And as we alluded to, the so-called genetic-based ones, that's never been done before. And there's never been a commercial mRNA vaccine. I don't think the details are critical for everybody. Here's the message. It's good to have multiple companies in phase 3. That's really fantastic. And multiple different types of vaccines in phase 3, in part because we have this, pencils down on AstraZeneca Oxford until they sort out what happened to this woman apparently with transverse myelitis. So the summary, I think the take home is multiple vaccines, good idea. That's a good thing for everyone worldwide. And yes, it's likely that the CDC will allocate different kinds of vaccines for different parts of the country. This is all in evolution as we're speaking.
So with that, we know how the difficulty was in for example, just our country hitting the threshold of, say, 10 million people getting tested for COVID.
Right.
We're talking about the need once the vaccines are out of getting it distributed to 300 million people
right.
plus.
Plus,
Talk to us about that.
potential 2 doses too, depending on which vaccine. Right. So I think that's why we've seen, Kevin, and it's a great question. I think that's why we've seen a lot of very recent press about the CDC saying to local health departments, get ready, have your dissemination and distribution plan ready. So let me give you a good example. So I live in Montgomery County, Pennsylvania, one of 69 or so counties in our great Commonwealth. And one of the public officials, our county commissioner, her goal is to use current testing sites as future distribution sites for the vaccine. So in a way that I think of it, they're sort of, if you would, practicing to see what are the logistics, the parking, the crowds, the sign up, because we're going to need a really incredible, greatest logistic challenge in history to get the vaccine to everybody in the 4 phases as we think it will happen. So I'm hoping that health departments, county officials, mayors are talking about this right now, just like we are, and are working through a plan as to how they're going to distribute the vaccine. And then there'll be issues about, storage. And you saw the piece about if you're in the freezer business, this is a good time to be in the freezer business, among other things. Maybe some of our customers are. So I think here's the message. Good to ask your local health officials. What's the dissemination and distribution plan? I think that's a fair question for all of our colleagues who are listening in, and get more information about what the potential distribution plan looks like.
So what I'm hearing is it's going to be handled on state by state or local municipality by local. It will not be a national program held by our government, federal military or anything.
Boy, that would be super complicated. Everything is local. And we're talking about, the expression of the last mile, getting it to your arm and my arm. That's a tall order. So it's going to be a amazing patchwork quilt, I would predict, of how we're going to do this. Yeah, I've never seen anything written about a, military style line up here and get it. I think it's going to be local. And hopefully folks will follow the guidelines that are coming out of this special committee from the National Academy of Medicine. Some of the brightest folks we've got, including scientists, ethicists, physicians, nurses, have been working on this exact issue. That is, what's the timing and who's going to get it and in what order. I think also, Kevin, this is not going to be like a light switch, that we're going to turn on and off and everybody's going to get it. It's going to take months. So, as we get deeper into 2021, hopefully this process will be moving along at a good pace.
With the flu season now upon us, do you recommend everyone get a flu shot? And if so, will it help in COVID-19 prevention at all, do you think?
Well, yeah. So it's a great 2-part question. So the first part's easy. Yes, for heaven's sake, get a flu shot. And I'll give you a good example at Jefferson Health, our 14 hospital system. As a physician, we are not allowed to see patients until we can prove that we got our flu vaccine. Every year we have to do that. So, what is it that doctors know that folks don't know? So, yeah, get a flu shot for everybody. And if you're over 65, talk to your doctor. You may need a booster dose and so on. Now, what do we know about the flu? Well, every year it's a roll of the dice, right? We don't know exactly which flu is coming. There's scientists who have worked on this. Typically, a flu vaccine is about 40 to 60% effective on a season by season basis. And that will help create a little bit of herd immunity. Here's the message: get a flu shot, especially if you have an underlying medical condition, especially if you're over 65. Now, will that prevent COVID? No, it won't. Will it help separate out, so if I have a bad respiratory infection and I've gotten a flu shot, it's more likely that I have, something else is going on. So a cold, COVID, other issues. So the other issue with the flu is protecting the hospital system, right? So we want to get people vaccinated so that we have fewer hospitalizations and fewer deaths from the flu to protect the healthcare system if we are unlucky enough to have a second COVID surge. So in that regard, for your second part of your question, Kevin, there's no cross reactivity. It's a totally different virus, completely different. But we want to keep people safe, healthy, and out of the hospital because we don't have the COVID-19 vaccine yet available. That's the way we should phrase it.
Very good. Mask wearing continues to be a hot topic of debate, and I would think over the next 50 days, up to our presidential election, it will continue to be that point.
Right.
But as I've heard you say before, and I love the quote, if 60% of the population wore a mask that was 60% effective, we'd kick this thing.
Right.
A recent report highlighted Philadelphia as having one of the highest rates of mask wearing in the country, and subsequently, our rate of infection has been on the general decline since, I think, May. Is wearing a mask still the best thing, along with hand washing?
Absolutely. Absolutely. So, and I'm glad you remembered what I told you. So let's go over this again. You can't talk about this enough. So we know from past pandemics, scientific new evidence, new laboratory and research evidence about the size of droplets and all the rest. Here is the major, most important take-home message, which is wear an appropriate mask. So we mean not just a bandana, a very inexpensive but highly effective paper surgical mask. You could buy at any drugstore now. Thank goodness they're readily available. They're inexpensive. The most important thing we can each do is to wear a mask wherever we are. Let me give you some examples that folks may not think about. So I try to stay active. There's a beautiful high school track 5 minutes from my front door in suburban Philadelphia that I've been using almost every morning. I have a mask on under, when I'm running, I don't necessarily wear it, but when I pass somebody or there's kids practicing or there's other people racing past me, I got that mask on. And so should everybody else. When I go to the grocery store, when I'm getting gas at the gas station, wear a mask. Next to a vaccine, it's our most effective tool to crush the virus. Now, if everybody wore one all the time that we're supposed to, we would have crushed this thing months ago. So the take home today is masks are our most powerful weapon currently against the virus. Now, if you have an N95, which is a little bit uncomfortable to wear all the time, but if you're in a clinical situation or if you have a loved one at home who's elderly, has underlying health conditions, and you have to take them outside to a doctor's visit as a good example, the better the mask, the better, and wearing it. But the most important thing is wearing a mask when you're out of your home all the time. It's very frustrating to me, Kevin, even in our great city, and I'm sure our colleagues from across the country see this. I see families out and about, and paradoxically, the little kids have a mask on, but mom and dad don't. Oh, good gracious. You want to go over and say to those parents, what's going on here? So little Johnny has his mask on. What's your problem? So truly, the message is, all kidding aside, mask, mask, mask. It's the most important thing we can do. Now, when you're eating outside, it's kind of hard to eat with a mask on, so we got to be careful about where we go, how we do it, but mask wearing still our most important weapon. I know it's a pain. I know it smells bad. That's why you need to keep getting new ones. We don't often talk about it. I know it gives people, skin eruptions. I get it, but it's a small price to pay for our most effective current weapon.
And I think if you look around the world, we've turned it into somewhat of a political statement, but you've seen so much happening around the world.
My goodness.
China, I know that Marriott, I was listening to the Marriott CEO on his quarterly earnings call a couple of weeks ago, talking about them being in China back to almost February levels of business.
Right.
So granted, they are a different country, and we don't want to take the approach of being a communist country, but they took a very strong approach to wearing masks, and that's one thing they're doing. You see in Europe, and while you're having pickups and hotspots here and there, they had a very aggressive approach to wearing masks, and you're seeing their economy pick up so much faster.
Well, I'm so glad you said that, Kevin, because this is the connection that certainly our colleagues on this call can be real proselytizers and educators, right? You want to get back in business? Wear a mask. I mean, it's a direct connection. And I think it also, the softer piece is it's patriotic to wear a mask. Totally correct. It shows your concern for your fellow citizen. Now, that's a little softer sell. I'm all about that too. But if you want to be back in business and open up, wear a mask. I mean, there's a direct connection. And the evidence, look, this is not just Dr. Nash talking. There's lots of very smart people, way smarter than me, with great research over a long period of time. Wear a mask. Let me tell you a story. My physician wife and I were lucky enough to go to Japan just a couple of years ago, delivering a speech, and we're on the streets in downtown Tokyo and Kyoto and Fukuoka, and lots of people are wearing masks. And we say to my host, what's going on? And they didn't understand the question. What do you mean, what's going on? These people are protecting you and me because they have a cold, they're worried about pollution and so on. So in that sort of very homogeneous society, as you alluded to, it was a sign of respect for one another that they were wearing the mask. It was not only culturally accepted, but lauded and approved and used as a good example of good hygiene, good public behavior. Now, look, we're not Japan, I get it, but to politicize a scientific issue, that I think is abhorrent. Mask wearing shows that you're a patriot. That is the key take-home. I don't care what party you're in, it's irrelevant. Great
line, I love it. On another note, the mental health aspect of a quarantine has certainly taken a toll on us all. What are your thoughts on and recommendations on keeping sane and keeping our families and ourselves mentally healthy throughout this process? Because we've got another few months to go with this, at least.
Right. Well, let me get a drink of coffee to answer that question. And I hope you like my Jefferson product placement too.
I do, and we'll have to get you a PHLCVB mug too for your future.
There you go. So look, we know, and again, as a primary care doctor, behavioral health is 1/4 of everything we do pre-pandemic. So I'm very sensitive to this issue in a very positive way, meaning, look, we've had unprecedented stress. I'm involved with multiple organizations who are looking at this issue. Let me give you some examples. Prescriptions for drugs like Ativan and other benzodiazepines are skyrocketing. Referrals for telebehavioral health skyrocketing. Unfortunately, also alcohol use, opioid, domestic violence, all of which are a reflection, I think, at least in part, of the unprecedented stress that our country is under. Let's not even talk about food insecurity and unemployment. I mean, the list is formidable. So for our listeners, my advice is pretty basic. It goes something like this, talking about it is a good idea. Getting these feelings out in the open with family members and even clinicians as necessary. Trying to get some decent sleep. Trying to have a pretty good, meal plan and eating healthy food. and exercising. I mean, doesn't that sound boring to most people? But we know that it works. Appropriate rest, appropriate energy from food, appropriate exercise. Hopefully, now's not a good time to be smoking cigarettes and drinking excess alcohol. We have enough stress, and you want to be as healthy as possible. We got the flu season coming. We're not out of the woods, certainly not yet, on the pandemic in many cities, especially those college towns, which are the new hotspot. So my behavioral health recommendations are: get it off your chest, try to have a healthy diet, try to get enough sleep, try to ramp up the exercise. All of those pretty, battle-tested recommendations are more important today than ever before. Now, if you're in a real crisis, well, reaching out to appropriate caregivers, and as I alluded to, the so-called telebehavioral health is an incredible resource for people who can't travel, don't want to be face-to-face with a doctor. Jefferson Health, as one example, we're using these tools, I think, in a very effective way. So there's hope and there's help as needed. But Kevin, I can't sugarcoat it. You and I, and probably most of our listeners, we're very blessed, right? We're here, we're working, we have a roof over our head. We're not in a line for food. I appreciate and I try to understand the stress that those folks must be under. It's probably unbelievable. And so sure, their mental health is going to be at great risk, unfortunately.
I'm sure many of us believe we're being, COVID careful, yet some of us are taking more extensive precautions. Do you think there's a point of diminishing returns when considering the health or work or travel balance there?
Sure. Well, I think about the ancient Greeks, right? Moderation in all things, including moderation, So I have some neighbors who have not emerged from their home in 6 months, haven't gone for a walk, haven't stepped outside. Now, okay, that's a real challenge, I think, for their mental health. So I think if we wear a mask, if we socially distant when we're outside, I think it's perfectly safe now to do a lot of mostly outdoor activities and the essential ones, going to a drugstore, going to the grocery store. Our region, 3 months ago, I myself was leery about going grocery shopping. They weren't wearing masks. They hadn't put the social distance stickers down. I thought they didn't set aside senior citizen hours. Now I think we're getting much better at doing all of that. So I think if we stick to the basics, the mask wearing, the hygiene, the social distancing, I think we could do a pretty good job. Does every home need an ultraviolet bug killer like in the hospital? Probably not. Is it a good idea after you pump gas to do some hand sterilization? Sure, that's a good idea, absolutely. And avoid, unnecessary social contact? Sure, that's a good idea. Should we be a little bit more, tuned in to keeping our places clean? Definitely, especially if we're in a work environment. But I think you could take that to a certain extreme, as I alluded to, of folks who haven't been outside in 6 months. I certainly wouldn't recommend that. That's taking it to a degree that's not healthy. In the workplace, using smart hygiene, good that they're wiping down the elevators, they're restricting the number of people. In my own building in downtown, which remains closed, except if you need permission to go in there. And when you do, you have to wear a mask, be socially distant. They've done a great job doing extra cleaning. I think that's all helpful. But look, at the end of the day, it's really not about the surfaces. It's about those respiratory droplets and being too close to other people who may not be wearing a mask. That is the key driver as we've come to really understand that clearly. Cleanliness is great, that won't solve the problem.
It's interesting you say that because I think, as you know, as part of our industry, you've seen airlines,
Yes.
Amtrak, our hotel partners come out with amazing programs to clean. But again, it goes down to the simplicity of wearing a mask. And
Yes.
again, billions have been invested
Yes.
to a good cause, to clean up facilities and buildings, which needs to be done. But when it gets back to a $10 or $5 mask,
Oh, yeah. $2 mask.
effective,
Even. Right.
amazing.
Yeah. So let's talk about the cleaning. Look, there's certainly a lot of evidence about the appropriate air filters and, moving outside air in sufficient quantities and with a sufficient frequency. There's no question that airlines have really stepped up on the filtering because you're in a closed environment with people breathing. So I do think the air handling has been really advanced. I think the cleaning and killing viruses on contact, all of that certainly helps because it's the touching and then touching your hands and face and then talking and oh boy, then we have a problem. So I would not reverse any of the cleaning or air handling, certainly not. And I applaud, as you alluded to, what we've done, what your team has done, what many of our listeners, I'm sure, have done. But it's still all about people-to-people aerosol contact at the end of the day. If you could cut down the touching and the and clean the filters and have those HEPA filters, that's really a step in the right direction too, definitely.
Before we get too far along, I want to remind all of our attendees that there is a Q&A option at the bottom there while we're asking the questions that many have submitted. Please feel free to submit questions, and Alethea on our team is in the background. She'll filter through those and share them with us. Moving on, talk to us about what practices you've seen in Philadelphia or maybe nationally, either from venues or attractions or hotels or restaurants, to provide optimism about the industry's ability to host large events again soon.
Yeah. Well, I think in our own town, we've, as led by your team and others, we've really upgraded the ventilation systems in the convention center and in many of the hotels, new cleaning protocols, a new accreditation system, which maybe you should chat about. I mean, I think we've done a really good job with the ethos of we're ready when you are. When the city says it's okay for us to have larger meetings, we'll be there. We're ahead of them, and we've got the cleaning down, we've got the ventilation down. I'm very proud of what we've done. Also, we have a low prevalence rate, even though we've ramped up testing. The prevalence rate is still relatively low. That's good. Look at New York City. I mean, it's been a bear, and they are just about to open indoor dining. I get it, but they have crushed it. And let's remember where they were just a few months ago. Gosh, what an amazing public health victory in a city like that. And California's done a better job. Look, I think not only have we done a good job on the cleaning and the ventilation, we've ramped up the public education like we're doing today. And I'm grateful for the opportunity just to be a conduit for the education and to help people sort through some of the science and try to be the best communicator that I can. And I encourage other cities to do what we're doing in that regard. And I think the testing community, the testing industry, they've made great advances. We're not exactly where I wanted to be by September, which would be widespread point of care, 15-minute results. We're at the edge of this. And certainly by Halloween, let's say, we will have nationwide, in my view, much better distribution of less expensive, not as accurate, but less expensive screening tests in most places. And the colleges, the sports teams, they're the leading edge on all this. I mean, kudos to the NBA, the NFL, whatever team you cheer for. On the one hand, they're really doing a great job keeping these bubbles working. On the other hand, from a public health and population health perspective, this is a little scary in that very wealthy organizations have the wherewithal to create these artificial bubbles. So I'm interested in the science, but from a population health perspective, Kevin, let's not kid ourselves. Unlimited resources, you can do an awful lot, right? I want to see widespread, inexpensive, accurate testing in the public setting just as soon as possible. That will be critical.
I think there's been a lot of dialogue lately about translating that to the vaccine.
That's right.
You point out the wealthy can get tested, the NBA players can get tested every day with quick results. When the vaccine comes out, ideally you want those needing the vaccine the most,
Let's
those
hope
that might
so.
have underlying conditions versus you can buy your way to the top of the line. But
that's right. Well, look, we live in America. We're a very heterogeneous society, whatever your politics. That's why I'm all about the phase 1 through 4, the National Academy of Medicine, the special ethics group that has been impaneled and empowered to make specific recommendations. I'm really hoping that we'll have a just and equitable process. We have to make sure we engage communities that were disproportionately hurt by the pandemic. That's in process. And, let's listen to the experts. Unfortunately, Kevin, again, it's not a political issue. There's been a pushback against scientists. I don't get that. These are folks who have spent their life trying to use the best available evidence. There's a good expression, watching science unfold is not for the weak-kneed or the weak-stomached. It's messy. Every day we have new information that changes our approach. Well, this makes the average person, it's unsettling. Watching science unfold is a messy process. That's the way it is. So we have to get used to that and, follow the recommendations. But back to your point, I'm very hopeful about an effective and safe vaccine. I'm very hopeful that we'll do it in those phases. I think it should be done at the local level. And I hope we can all get engaged in the process together. Yeah, definitely.
So the vast majority of our audience today are our meeting partners, clients and event planners. If there were 2 or 3 things you'd recommend they do now or early on in the planning stages, what would they be?
Yeah, great. So education, and communication. In our business, Kevin, you can't over communicate, right? So the first thing is let's do what we're doing here, right? Tap into the expertise you've got locally and nationally and continue to read and stay informed and spread the science, not the virus, right? Easy to remember. Spread the science, not the virus. So that's step 1. Step 2, we've talked about it. Be a leader and wear a mask and show everybody that you're a patriot, that you care about everybody else, and you're practicing based on the best available evidence, how to crush the virus. Do the hygiene, do the social distancing, stay at home if you're able to. If you're going to travel, do it smart. Let me tell you a story. So as I alluded to, my wife and I flew to Florida. So Philadelphia to Florida, 2.5 hours. So what did we do? Well, we wore an N95 mask, readily available, not expensive. We added one thing that might be of value, and we wore goggles because of the aerosolized aspect of what's going on. Frankly, I was very nervous, but on the flight home, I was way less nervous because I saw that everybody else had a mask on too, and not everybody was wearing safety goggles, of course, but everybody had a mask and seemed like they were cooperating and collaborating to stay safe. The risk is not so much the airplane. The risk is the airport, the coming and going. When we got off the plane in Fort Lauderdale, good story here, we hadn't checked the bag, so we had our carry-ons. We walked to the rental car place. We didn't get on the crowded rental car bus. But lots of people, when we were walking within the bounds of the airport, didn't have on a mask. including the guy running the taxi stand. So, everybody's walking up to him and he's talking loud, didn't have on a mask. My hair was standing up. So you could be smart, wear the mask, wear the goggles on the plane. When you get off, don't hang out indoors, walk outside as soon as you're able and it's safe. So this is just common sense, good things to think about. Is there some risk? Of course. So everyone has to make his own risk assessment, right? And do the best you can to mitigate those risks. That was my one travel experience. Staying in a hotel, similar sort of thing. What do we want from hotels? Well, we want to see that they've got published protocols, they understand the issues, they support outside dining wherever possible. If that's not possible, they have appropriately socially distant. The one hotel that we stayed in Virginia, you could elect no room cleaning. They leave a clean towel outside your front door. Okay, great. So I think many of our customers are working with hotels that get it and have implemented very appropriate protocols. I was very comfortable in the hotel. It seemed like they were following all the rules. They set a high standard by in the lobby, you had to have on a mask. They called you out if you didn't, and that's appropriate. So that gave me comfort.
We've got a question from Eric Zimmerman. Obviously Philadelphia is a huge host of medical conferences. About anywhere between 30 and 40% of our business on an annual basis for citywide conventions are related to the healthcare industry. Eric is asking, what's going to make you feel comfortable about attending a large medical conference? Or will a vaccine have to come out before you feel comfortable doing that?
So that's a great question. So the short answer, what would make me selfishly feel comfortable, it would depend on the size. So look, if I'm at a meeting and we're socially distant in a big auditorium and we're talking about 50 people and we're following all the local mayor and other recommendations, I'm okay with that. And if I know I'm in a great convention center that's paid attention to ventilation, hygiene, touchless bathrooms, I would go to a meeting like that tomorrow. Now, a 1,000 person meeting is a different story. For me, I think those organizations would have to have a testing plan, similar to a college or a sports team or any other large organization, where they would promote quarantine before coming, screening, testing of all attendees. So you might have to come a day in advance, and that you'd have a collaborating hotel. So if I had a collaborating hotel and I had good screening tests readily available, and I got a little badge or I got a thing on my phone that said I was negative, and then go to this room, I would be okay with that if an organization followed those sorts of guidelines right now. The reason I say this is I have confidence that others have been able to build these bubbles around the country, as we've already discussed. So look, 50 people or fewer, I'm okay with that tomorrow. 500 people or more, not okay tomorrow, unless it was at a great convention site that followed all the rules and there was readily available screening, hopefully managed by some outside group who knew what they were doing, had experience with this, and I would say that you had access to great medical care for doctors, nurses, pharmacists, and others who were readily available if you had questions or symptoms. So that kind of partnership, I'd be looking for that as well, similar to what you and I are doing.
Interesting. As we talk about the vaccine getting implemented and distributed to 300 million people, do you sense a phase to where, say, half the population, say it's March of next year, and
Right.
150 million doses have been distributed, and there's an instant test that's available now within 20, whatever they're saying,
Right.
some 15 minutes.
Right.
Do you think that implementation of both of those sorts of things will be in place to where not only meetings and conventions, but all sorts of businesses are able to do that
Yes,
sort of thing?
I'm confident by springtime, let's call it, of 21, that certainly the testing is going to be much more readily available, less expensive, fully deployed, hopefully more accurate and reliable. Yes. So I think that it's like maybe it'll be a 1, 2, 3 punch. Punch 1, masks. Punch 2, testing. Punch 3, vaccine. That would be great. I'm reluctant to put a specific timeline on it, Kevin. My crystal ball is cloudy, and I'm not a soothsayer. But I think if we did all of those things, so there's no silver bullet. Remember, it's not a light switch, no silver bullets, not overnight, everybody's vaccinated. It's going to be a spectrum. And I think your comfort level has to be where on the spectrum of prevention, does each person fall. For me, what you just outlined, hopefully by March of 21, we've got a lot of people vaccinated, especially the elderly and first responders. That would be great. So we know we protect the system if we need it. We're still wearing masks. Oh, and I could walk up to a kiosk at our great convention center and in 15 minutes know what my status is. That would give me a lot of comfort, surely.
Meetings and conferences centered around speakers and discussions can more easily adapt to socially distanced floor plans and seating arrangements. But a large amount of our conventions have a large and vital trade show component, sometimes approaching 700,000 square feet of space, for example, at our building. What advice do you have for those partners who rely on those types of events in terms of interaction at a booth, either for product demonstrations or to connect with others?
Great. So first, let me say that I feel some of their pain because, as you know, Kevin, I run and have for almost 20 years now an annual event in Philadelphia, 1 minute of shameless advertising for our event called the Population Health Colloquium. Now, we have 35 exhibitors and a couple of thousand square feet, so it's not gigantic, but my customers are asking me the same question. So here's my answer. I think we could direct traffic. We could spread the exhibits out, to socially distant. And what's really great, the new software capabilities all online. Let's set up appointments. So I know I'm going to come to your booth at, 10:15 a.m. and at 10:45, I'm going to have to leave because somebody else is going to come. So we could organize our time. We could socially distant. Let's have some hand sterilizer readily available. And if we both have a mask on, I'm good with that. So I think our exhibitors, depending on the size, of course, and the space that we're in, we could do a pretty good job of satisfying their business needs and keeping everybody safe as well. I'm very confident of that. But again, to review, we'd have to spread out. We'd have to wear a mask. We'd have to clean our hands. And we'd have to be in a great center like ours that is already dealing with air filtering and hygiene in the bathrooms. But I think we'll be able to do that. I'm anxious to get back to the exhibit floor and get to meet new people, see new technology. Absolutely, I think we could do that safely.
Right, great to hear. Lisa Astorga asked a question. She says, which is she's a great Philadelphia client, and it's a great question for us here. She is asking, half of my attendees are international with our medical congress in July of 2021 here in Philadelphia.
Wow.
We had originally expected 10,000 physicians. When can we expect international travel to resume? So that might not be your play, but what would you say about that?
Right. Well, let's look at it. It's a really tough issue at the moment. So sadly, the United States is on a lot of no-fly lists from other countries who have done a much better job than we have, right? So I think we're going to have to really up our game to be able to bring people from other countries via air travel back to the United States. We're making progress, but July, again, I hate to be held to a specific month and date, but late summer 21 in our town, if the mayor says, we could have more than 50 people, I think we'll be ready. If they're ready, we'll be ready. So of course we'll follow all the guidelines, but if we're lucky enough to be in that safe zone in July of next year, I think Philadelphia will be a very welcoming and safe place Certainly by that point in time, I sure hope so. We're doing all the right things. A lot of this is out of our control, of course. With regard to air travel, again, the airlines have come a long way in terms of seat restrictions, no penalty for changing your tickets based on how crowded the plane is. And again, the best evidence is it's not the time on the plane that we worry about. It's the time in the airport and the embarking and disembarking. That's a much higher risk category. However, if you're talking about, a 15-hour flight from Malaysia to Philadelphia, that could be a little bit more complicated. There's not enough evidence at the moment because not enough international coming to the U.S. travel has been done for us to study this. My own view would be probably safe. I sure would like to have testing when I landed, so before I went to the meeting, however. And as you and I talked about, again, mask wearing, testing, appropriate venue, and the vaccine. Wow. Now we have a toolkit that we could really use all the tools.
So speaking of that, Will, do you see that maybe once we get those things in place and everyone's been vaccinated, do you see that staying in place, some of those steps, do you see maybe a slow waning out of that type of thing, even
Yes,
though we've all been vaccinated?
that's right. I don't think it's going to be an on-off switch as we've talked about, Kevin. This is going to require patience on the part of everybody. It's not a magical, everybody's got vaccinated, now we don't have to worry, which is why you hear all the national experts and all the great communicators talking about, we are in this game for at least another year, meaning, our awareness of the issue around us. It will not be, a big celebration in July of 21 that it's over. That I don't see that happening. It will be a spectrum of activity and a keeping our guard up over an extended period of time.
I think we have time for one more question. Someone asked, do you think youth sports will be able to resume tournaments in the convention centers in early to mid 2021?
Youth sports in the convention centers. Give me an example.
So, for example, we host in a number of cities. We'll host a major volleyball tournament where we might bring in 10 to 15,000, mostly high school students.
Wow. Yeah. So I think many of the things we've chatted about still apply. And as a parent, I might be a little bit more persnickety on the details. What's the chaperoning? What hotel? How much testing is available? What happens when a youngster deviates from the appropriate behavior? That would be further down on my list of things I'd be comfortable with, quite frankly. I mean, if we're dealing with an adult population, that's hard enough. If I have young people, that's going to be difficult, as evidenced by the very difficult situation we've put young people in by going away to college. Right. I mean, this is the new hotspot. And everyone saw it coming. I think people forget what it's like to be 18 again. And we won't go there, Kevin, but, I get it. What were they thinking would happen? And the screening that's necessary, the quarantine, the feeding, the appropriate, I'm glad I'm not a college president. That would be a very tough job right now.
Well, we are at an hour. We've covered a lot of information. We asked a lot of questions. We're going to do our best to try to answer every question we got with Dr. Nash's help and send them back out to our participants. Great. But I want to thank you, Dr. Nash. As always, wonderful information shared in a very easy to follow. And for us, I'll say this, dumb people, it's you make it so simple to understand the tougher issue we're facing right now. But I want to thank you. I want to thank all of our registrants and our attendees and partners and clients for jumping on this call. We might look to do something similar in a couple months because, as we all know, this is transitioning so fast. What changed? Where we are today is very different than where we were 2 months ago or obviously in April. So we look to do something similar in a couple months as we get closer to a vaccine or maybe once one's been out for distribution. So look forward to that information from us. But again, to all of you and to Dr. Nash, thank you so much for your time this morning. Have a great day.
Thank you, Kevin, and everybody, please wear a mask. Thanks again.
Thanks. Bye-bye, everybody.